My name is Emily Fetters, and I am the Community Social Worker for the City of Chelsea. The Community Social Worker position aims to address social service gaps in Western Washtenaw County, but more specifically within the Chelsea School District area.
The city has border-to-border trails. They have city parks for people's physical well-being. Bringing Emily on to help people with their mental well-being just makes sense to be a well-rounded program to give the citizens the best possible life they can here.
So, it is, as a public library, we see a lot of people coming in and out of here, and people with requests for things, and we would do the best that we could, but we are not trained to provide those kinds of services. And the way that Chelsea has done it, which seemed almost like this Herculean feat in the beginning of taking these disparate organizations and having them all come together with this huge range of needs, but being able to funnel that all into this digestible piece, this position that addresses all of those things. And it really is an example to other communities. For the city to take that role in the lead on this is, I think, extraordinary.
The city's partnered with, actually there's 5 partners in this pilot program. City of Chelsea, Community Mental Health, Chelsea School District, Trinity Health, and 5 Healthy Towns. And the inspiration came out of meetings with community shareholders wanting to know how can we address the national mental health issue that is facing this country on a more local scale.
This position provides resource navigation services, referral services, and mental health crisis response to individuals and families within the Chelsea community. 5 days a week, you can typically find me at one of my public office locations. While hosting office hours at the Chelsea Senior Center and the Chelsea District Library, it's not uncommon for me to work with individuals and families who are wanting to learn more about mental health resources, in-home care support for their loved ones, and legal services, among much more. If an individual is experiencing a mental health crisis, I am able to work with that individual, their loved ones, and the Chelsea Police Department to provide on-site support, help de-escalate the situation, coordinate appropriate care, and facilitate connections to resources within our community.
It's a huge asset. It's a huge asset for the city. I think the biggest part is when the officers or the city employees come across someone that is in need of some assistance. It allows us to do a face-to-face with Emily, talk with her, explain the situation better than an email can, and then work with Emily to solve that problem. It's a collaboration is what it is.
When considering the needs of the Chelsea community, these needs are largely going to relate to mental health, access to basic needs, transportation, and senior supportive services.
I think this program shows that even a small city such as Chelsea, when partnering with the right stakeholders and business owners, can accomplish great things, and that's exactly what we're doing. We couldn't be able to provide the level of service that we currently have here at the city without her help.
She has modeled for us, for our staff, how to engage respectfully with people who are vulnerable. The other piece of it is she has been instrumental in this community care collection that we built here.
The Community Care Collection, located at the Chelsea District Library, is a collection of both materials and resources that are available to patrons of the library for free and are not required to be checked out. The Community Care Collection is located within a more private area of the library, which allows patrons the opportunity to browse more personal topics such as mental health, substance use, and much more.
Since it started, maybe like 6 months ago, we have at least 40 items have been taken and have been dispersed throughout the community, and hopefully are doing good there. I can't say enough about how she models what we want to be here.
As a community social worker, I understand the unique needs, cultures, and challenges of the community that I support. I am able to build rapport and trust not only with the individuals and families I work with, but also all of the entities that contribute to our community's well-being. Through this position, we are able to collectively meet people where they are to provide support, resources, and opportunities that foster positive change. Through this position, I have seen time and time again that our community is thoroughly interwoven with individuals, families, and organizations working collaboratively in meaningful ways to support one another. I'm given the opportunity to work with so many people who invite me into their lives to learn a fragment of their story during times that are often so personal to them. In addition to this, I'm able to provide a trusted and safe space where people are able to show up as the most authentic versions of themselves. These are just two of the many reasons why I love what I do.